Scientists have warned that in a worst-case scenario, a second wave of coronavirus cases in the UK could result in around 120,000 more deaths. The report says the virus can survive longer in colder conditions and is more likely to spread when people spend more time indoors. It comes as 138 more deaths have been registered in the UK in the past 24 hours. The 7-day rolling average is 82, and the total number of deaths is now 44,968. Here's our health editor, Hugh Pym.
Hospitals under pressure at the recent COVID-19 peak.
How's that feel? Yeah?
Intensive care units filled with very sick patients. Now a new study says something similar or even worse could happen over the winter.
We're not making a prediction, we're just trying to look at what the worst might be. But sometimes you just have to look at what the worst might be in order to focus your mind on the things that you can put in place to stop it happening.
The reproduction number known as R shows the spread of the virus. Above 1 means it's accelerating. Currently it's in a range of 0.7 to 0.9. The report looks at what might happen if it goes up to 1.7, about 120,000 COVID-related deaths between September and June. But if it's at 1.5, it would be more like 75,000. And if it's at 1.1, close to the current level, there might be under 1,500 deaths. None of these allow for any government intervention. The report calls for urgent preparations to reduce risks, including supplies of PPE and training for staff. Here they're carrying out operations for other conditions with COVID patients treated elsewhere. This is what a COVID-free hospital site looks like. Rigorous infection control, temperature checks for everyone coming in, including staff, hand sanitizer and masks handed out. The chief executive at this major London hospital told me he felt they were well prepared for what might be ahead.
We have learned a lot in the past few months. We now know how to deal with COVID. I think the treatment of COVID patients has improved. We have widely testing available, so we can make a rapid diagnosis within 30 minutes in A&E. Any following peak will be different than the first peak we've just seen in March and in April.
Across the NHS, some patients like Libby are suffering because of a backlog of work cancelled during the crisis. Her knee replacement due in March was postponed and she's still waiting.
I'm even dreaming that I'm in pain and then I wake up and I am in pain. So it's the not knowing for so long is obviously playing mentally, how you feel about yourself.
Millions of patients waiting for surgery and a possible flu outbreak will, according to the report, add to the intense pressures which another COVID surge could bring. Hugh Pym, BBC News.